Hello, everyone. Good morning, good afternoon, good evening, everyone. Welcome to session 6 um, of the South and Southeast Asia Climate and Health Responder course. Today's session title is Extreme Weather Event Disasters, Typhoon, Cyclone, Glacier Melting, Island and Coastal Flooding, and Waterborne Diseases. As you can see here, this is the sixth session, and it is wonderful to see so many of you continuing with us each week. And let's quickly highlight the learning objective of this session. So it's explain how climate change intensify extreme weather events, cyclones, typhoon, glacier melting and flooding, and disrupt the hydrological cycle affecting water availability and quality. The second one is identify short and long-term health risks from extreme weather event, water scarcity, and water contamination, and outline health professional role in reducing these risks. Then understand how biological, social, economic, and structural factor can heighten vulnerability to extreme weather hazards and waterborne diseases, particularly in South and Southeast Asia. Then the identify the role of disaster risk reduction, early warning system, public health communication, regional cooperation in preventing health impacts and minimizing forced migration. The last one is apply knowledge of climate impact on waterborne pathogens, in which includes leptospirosis, Campylobacter, Salmonella, Cryptosporidium, norovirus, and Vibrio cholerae to improve the disease prevention and response strategies. Then regarding the attendance instructions, just a reminder, attendance is automatically recorded during the live Zoom sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with the colleague link. So keep that in mind. Your YouTube views will not count towards that attendance. Regarding the certification of participation, participant who attend at least 7 out of 11 live Zoom sessions um, and pass the final exam with a score of more than 70% at the end of the course will be awarded a certificate of participation in this course. Please note that the certification of participation is only available to person who use the same email address for registration and all Zoom sessions and exam. The final exam must be completed using the same email address used to attend the Zoom sessions. The exam link will be sent on the final day of the class via email and WhatsApp. And the format is 25 multiple choice, true and false questions. Participant should be prepared to take the exam in one sitting. So we have, as I highlight, we are joined by fantastic panel of speakers today. So the first, just a second, sorry. Okay. So I have Archana, Dr. Archana, Dr. Upasona, Dr. Thimna, and Ahammadul. Now we have Dr. Archana. I am, we are extremely sorry that for this confusion and the problems. You know that South Asia is very vulnerable to climate change. We are facing extreme heat wave in few areas and also extreme rainfall and rainfall in many areas. So there are some internet challenges that we have. I think this topic is very much in line with the problem and challenges that we face. So we have Dr. Archana. She has joined. And Dr. Archana Shrestha is Deputy Director General at Nepal Department of Hydrology and Meteorology and hold a PhD in atmospheric science from University of Wisconsin's Madison. She has over 20 years of experience in monsoon extremes, cloudburst dynamics, and community-based disaster management with a focus on turning climate data into actionable services. At DHM, she has led studies on Nepal's first recorded tornado, national climate trend, future climate scenarios. She also oversees DHM collaboration with the health sector to integrate climate information into health planning. So, Dr. Archana is over to you. Please go ahead. Thank you.
Um, First of all, I'm extremely sorry that, like I was not able to join earlier. So I will not turn on the video because of the instability in the internet connection. I would like to say sorry to all the participants and who have joined today. Um,
Can you please share your presentation? Yeah, Dr. Archana, you have 20 minutes, maximum 25 minutes. Please try to, yeah, finish it.
First of all, I would like to say thank you to for providing me this opportunity to talk about extreme weather events, disaster, and impacts on health and in South and Southeast Asia, focusing more on waterborne diseases. So today's learning objectives is that like how the climate change intensifies extreme events, focusing on cyclones, typhoons, and glacier melting that would disrupt the hydrological cycle, affecting water availability, and identifying short and long-term health risks from these weather events, and also understand the other socioeconomic and structural effect that would increase the vulnerability in this region, and also to talk about the role of disaster risk reduction and early warning systems and collaboration in minimizing the health impacts due to the extreme events. So I'll be talking about some examples and how the climate change would change those extreme events, and how the extreme events would change the water availability and quality and its implication on the health. And so basically, I'll be focusing on glacier melt, glacier lake outburst flood, and the tropical cyclones. So in Asia, especially South Asia and Southeast Asia, there are the major climate disasters are, or specifically weather-related disasters, glacier melt and glacier lake outburst flood, tropical cyclones and or typhoons, heat waves, drought, cold waves, and thunderstorm and tornadoes.
No.
But I will be focusing mainly on the first two disasters. So to talk about the glacier melt, so in the Hindu Kush region, and most of the mountains and cryosphere, there is a rapid glacier melt and snowpack retreat. And if you look into the recent report on Hindu Kush region, that it is shrinking in unprecedented way because of the rising temperatures and elevation dependent temperature increase. That means the temperature increase in the high mountains is at higher rate. And so at the current emission pathways, the report says that 80% of the glaciers is going to be gone by 2100 or in end of this century. And so the this report also talks about the melting of glaciers, especially it is from the Hindu Kush Himalayas. Melting of the glacier will reduce the snowpack, lead to the decrease in the river flows, and water availability in this region is expected to peak in the mid-century and then decline. So because of the rising temperature, so glaciers and snowpacks is going to melt, and because of that, the river flow will increase. But after the mid-century, because all the snow and glaciers is gone, So this is going to, the river flows will be decline. So the glacier dependent or snow dependent rivers in Asia will face water scarcity, and mainly it will get flow or water available only during the rainy season or monsoon season. So this is the biggest challenge that we will face because of the change in rising temperature causing change in snowpacks and then the hydrological cycle. So the disaster risk, another disaster risk is that once the snow is melt or glacier is melt, and also there is the permafrost, which is the snow and ice beneath the surface, which is called in the subsurface. The water bodies in the subsurface in the high mountains is called permafrost, and so when those permafrost ice is melt or glaciers are melt, then the very fragile geography or geology of the mountains would get exposed to the environment, and so the change in rain or snow precipitation from snow to rain will increase the erosion, landslides, and big like landslide dam lakes, and so this will increase floods and landslide in the high mountains, and that will cascade down to the downstream. So, so glacial lake outburst flood is especially a catastrophic event triggered by the sudden release of the water from the lake fed by the glacier melt that has formed at the site, in front, or within or beneath on the surface of the glacier. So once the glacier melts, the lakes are formed, and the dam, moraine dam or the ice dam, when it bursts, then the sudden catastrophic event might happen. So climate change induced glacial lake, because of the warming temperature, outburst floods and landslide are increasing natural hazards and disaster, posing threats to the infrastructure and livelihoods in this region. So the report has this report the same report has identified 200 glacial lakes across the Hindu Kush Himalayan region, identified as the dangerous lakes, and the region could see significant spike in glacial lake outburst flood by the end of the century. So this is an example. From the data collected from 1833 to 2023, so there were four historical events before 1833, and so there were, in this particular region, 486 gloves had happened, and which has caused 6,818 fatalities and 20,000 injuries, 90,000, more than 90,000 people displaced, and there is a loss of livestock as well. So especially this is for the region Afghanistan, Bhutan, Nepal, India, Pakistan, and China. And so, so Nepal has pioneered in the reducing the risk of gulf. So what we have done in Nepal is that we have lowered the lake, Sorolpa Lake, in 1990s and early 2000, and we have established a warning system. So Sorolpa and Imza are two glacial lakes which has identified as the potentially dangerous glacial lakes in Nepal. And so we have lowered the lake and established the early warning system. And since we have lowered the lake, these potentially dangerous two lakes hasn't been burst yet. But small glacial lakes, which are not identified in this report, and which has recently formed, small ponds, glacier ponds, has, like we have been seeing the Gulf outburst flood from these kind of lakes. For example, in 2021, Melamti region of Nepal, we have faced heavy rain, then Gulf and landslide dam outburst flood. And so this was, and this first heavy rain and then Gulf and then landslide dam lake, and then the whole Melamti Valley was devastated by the flood. And similarly, recently in August 2016, 2024, in Everest region last year, we had a Thame Glacier Lake outburst flood, which was not identified as the potentially dangerous glacier lakes. And similarly, this year we have in Western Nepal, in May 15, there was a glacier lake outburst flood which damaged and displaced. So one of the major effect is there is no fatalities, especially last year and this year. In Melamti, we had fatalities, but because of the increase in communication, use of mobile, local people to local people communication, even though we did not have the warning system. So the major impact is the impact on the infrastructure and the displacement of the families from the region, and an impact on the livelihood. And so we have worked with the local communities for the field visits, for the disaster reports, and for the action plan for the future. And so the major impacts, so there hasn't been the study done on the impact of the health from the Gulfs or the melting glaciers yet, but like because the melting glaciers would create the water scarcity in future, so it would create health impact because of the water scarcity and through the floods and through the displacement in the mental health. In terms of tropical cyclones, so tropical cyclones in Asia and yes, in South Asia and Southeast Asia. So in South Asia, it is called cyclones. In Arabian Sea and Bay of Bengal, in the Pacific or in Southeast Asia, it is called typhoons. So the cyclone season in Pacific is from June to November. It's a peak season, and peak month is August. And similarly, in Arabian Sea and Bay of Bengal is from May to November. And in an average, there's 9 storms in Bay of Bengal per year. It forms and impacts the coastal region. In Arabian Sea, in an average, 4 storms form in this region. And in Northwest Pacific, about 28 typhoons forms in an average. So there's a little bit difference in classification of cyclones and typhoons, but there is not major difference. It's a similar, so cyclonic storm, the cyclonic storm is equivalent to the typhoon in the Pacific. And so impacts of tropical cyclone is that like it is the largest population zone of the world, and it may impact through the high wind, through the coastal flooding and storm surge, heavy precipitation, inland flooding due to heavy rain, and landslide in the mountainous in the regions. So, to talk about how the climate change is impacting tropical cyclones, the global frequency of tropical cyclone is rapidly intensification has increased in past 4 decades, and the proportion of intense tropical cyclone compared to the overall cyclones is likely to increase, and it may also increase the wind speed and peak wind speed of the most intense tropical cyclone. And also it will increase, the most intense tropical cyclone might increase in future. So the total global frequency of tropical cyclone will decrease, however. So the total number, while the models predict that the total number of cyclones may decrease, but the intense cyclones may increase. So it is likely that the frequency of category 4 or 5 tropical cyclone will increase in limited regions, specifically in Western North Pacific, which is in Southeast Asia zone. And it is very likely that average tropical cyclone rain rates, so rain may also increase in this region. And so the global frequency of tropical cyclone of all categories may decrease or remain unchanged. And so to talk about the impacts of how it may impact the coastal regions. So mostly the coastal regions are vulnerable to compound flooding due to the wind-induced increased storm surge, as well as the heavy precipitation. So heavy precipitation, since in future the heavy precipitation may also increase, so the storm surge as well as increased precipitation may pose flooding issue in the coastal regions. And so this may cause damage to drinking water systems, damage to sanitation system, and decay of the dead, because of the decay of the dead animals, it may contaminate the flooded water. And so to talk about the cascading effect on the health, so so it may cause the death and injury because of the drowning and in the floods, and exacerbation of existing conditions. So when the storms, these kind of tropical cyclones occur, if there are vulnerable people who are already sick, may create problem to those sick people when the tropical cyclones hit. And similarly, it may cause mental health because of the traumatic reason of anxiety, depression, and post-traumatic stress disorder. So there might be many communities which may need psychological counseling or mental health support. Which is generally overlooked in the mainstream medical system. So disrupted health. So extreme weather may disrupt the healthcare access due to the damage in infrastructure, the hospitals, the power outage, the transportation issues, and leading to the complication and delayed in treatment. And so there's indirect effect as well. The extreme impacts may have indirect impact on health due to the food security. For example, if the agriculture system is disrupted, then food supply chains may be affected, and the malnutrition and food shortages may cause the health issue. And disease transmission, changing climatic condition can enhance the transmission of infectious disease like dengue and malaria, especially during the flooding system because of the tropical cyclone. And water quality and sanitation floods and other events can contaminate water sources, leading to the increased risk of waterborne disease. And similarly, vulnerable population such as the older adults, people with disabilities, and children may be impacted differently or at higher rate than the normal people. So the medical system or medical support should consider indirect impacts as well when we prepare for the extreme event impacts on the health. And so another thing that we can use to reduce the effects of the extreme events on the fatalities as well as to the health is through the early warning system and risk communication. So WMO has established the regional specialized meteorological centers and tropical cyclone warning centers around the globe. And so in South Asia, Indian Meteorology Department is the regional center, and in Southeast Asia, Japan Meteorological Department or authority is this warning center, and so they issue warning and they collaborate with the member states. And most of the coastal countries in South Asia and Southeast Asia has tropical cyclone warning system of their own in the mid department. For example, in Bangladesh, Pakistan, and also in Philippines and Vietnam. They have this warning system. And IMD issues the impact base, for example, IMD issues impact based warnings to all the concerned, including the government in India, the local population, media, stakeholders through the variety of communication channels. So this also includes the health system. And because of this, in recent years, the loss of life due to the tropical cyclone has been reduced significantly to less than 100 in any cyclone. However, there is a huge loss of property due to the tropical cyclone. And so IMD also provides tropical cyclone and storm surge guidance to 13 member countries like Bangladesh, Iran, Maldives, Myanmar, Oman, Pakistan, Qatar, Saudi Arabia, Sri Lanka, Thailand, and United Arab Emirates and Yemen. So this is the example of collaboration. And so, for example, because of this warning system, in 2008, in Nargis, a tropical cyclone hit Myanmar, caused more than 100,000 fatalities, while similar type of cyclone Mocha intersected the same coast in the vulnerable communities, but there were very little damage. And in Arabian Sea, the cyclone Biparjoy made landfall across the densely populated west coast in Indian Gujarat state, but there were no fatalities reported. Only 47 people were injured during the cyclone. So this is the advantage of early warning and risk. And so, and the role of national and international cooperation. So, WMO and its CAP panel in tropical cyclone has established in Bay of Bengal and Arabian Sea played a critical role in cyclone warning and reducing the fatalities. And the regional specialized meteorological center, for example, in India, IMD provides a sufficient lead time to the member countries and authorities to evacuate the coastal communities and in the safer areas. And these centers monitors cyclones throughout the Northern Indian Ocean and works closely with the member states to facilitate the delivery of early warning products and service to the tropical cyclone. And this is similar is the case in the Southeast Asia as well. And so, to give you the example, WMO the Global Framework for Climate Services, WMO guides or suggests us to collaborate, prepare the framework for the climate services. One of the thematic group is health as well. And so it promotes or encourages to collaborate the mate agencies like us with the health service for sharing the climatic data, for sharing the weather warning and seasonal outlook, and to produce the to co-produce the climate and health products that would help adapt during these extreme events. And so we have been doing pilot project to provide climate-based health advisories in Nepal in number of districts. And we are learning, still we are learning through this project. And so to conclude my lecture, so the impacts of extreme weather events due to the climate change is to be increased in future. South Asia and Southeast Asia is most densely populated zone of the world, and the coastal regions and mountain regions and its downstreams are vulnerable to tropical cyclone, glacier melt, glacial lake outburst, floods. And the impact of these extremes is huge on human health through water scarcity, water contamination, destruction of water facilities, waterborne and vector-borne disease, mental health issue, and health infrastructure destruction. In South Asia, early warning systems on tropical cyclone and GLOF has helped save lives. WMO and WHO is collaborating to combat climate-induced health issues, and they also promote us, and they also support at the country level as well. At a national level, Med agency should work with health department to reduce impact of extreme events on the health through co-production of climate-based health advisories, proper communication and preparedness during health disaster warning, and sharing the climate information with health sectors through the decision support service in health sector using the climate information. Thank you so much.
Thank
I
you,
hope
Dr.
I'm on
Archana.
time.
Yeah, you are perfectly right on time. Thank you so much. So, Dr. Thimna Lateef is the team lead and technical officer for climate change, WASH, and environmental health at WHO, Timor-Leste, with over 10 years of experience in the field and more than 15 years in public health. She led program planning and coordination, working closely with UN agencies, technical partners, and government bodies to provide policy and technical guidance. Her background include work in immunization, HIV, hepatitis, STI, neglected tropical diseases, and other communicable diseases elimination program. As a member of the UN Interagency Consultative Program and SIDS, she is especially committed to raising awareness and supporting health intervention that address the impact of climate change on vulnerability community. Over to you, Dr. Thimna. Thank you.
Hello, is that all right? Hello, Dr. Priya, can you see my screen?
Yeah, it's all right. It's presentation mode. Yeah, please go ahead.
Okay, thank you so much. Good morning, good afternoon, and good evening. So I'm going to present on Timor-Leste's actions on decreasing risk of flood on health, including waterborne diseases. So first of all, I'll give a country profile. So Timor-Leste is one of the youngest countries in the world, and it's only a 22-year-old country with a fragile health system. The population is around 1.3 million, and around 70% of the population lives in rural areas. Just to give a context, climate change, as you all know, can impact incidence of waterborne diseases, either through heavy rainfall, flooding, droughts, or changes in temperature. Some of the key risks include fecal contamination, increased concentrations of chemical and microbiological contaminants of surface water, which can obviously lead to gastrointestinal and diarrheal diseases. If you look at the right-hand side, you can see the diarrheal diseases are among the top 10 causes of death in Timor-Leste. Around 12.6% of newborn deaths and 8.9% of under 5 deaths in Timor-Leste is due to diarrheal diseases. WHO also estimates that 61% of deaths from diarrhea in Timor-Leste is caused by...
Sorry, Dr. Thimna, can you just come close to the microphone? Like few participants are not able to, can you be a little louder? Sorry for the interruption.
Okay, okay, hope it's better. So I just was mentioning that diarrheal diseases are among top 10 causes of death in Timor-Leste. Around 12.6% of newborn deaths and 8.9% of under 5 deaths in Timor-Leste is due to diarrheal diseases. WHO also estimates that 61% of deaths from diarrhea in Timor-Leste is caused by unsafe drinking water, sanitation, and inadequate personal hygiene. And also we know that droughts and as well as El Nino can also result in lack of clean water for drinking, cooking, and also can lead to water accessibility and water scarcity. If you look at the right-hand map, you can see that in general in Timor-Leste, it's the socio-economic vulnerability is quite high, from medium to high risk. So children, elderly, and those with underlying health conditions can be especially vulnerable to waterborne diseases. And to give a brief idea on some of the key climate hazards in Timor-Leste, the mean annual temperature of the country has increased with the rate of about 0.016 degrees per year. From 1990s to 2023, rainfall trend is increasing, and 2021 was the wettest year. And one of the most challenging aspects is the rainfall variability is happening, and it's apparent mostly in December, January, and March. Sea level is also risen about 5.5 millimeter per year, according to the second national communication of Timor-Leste. Some of the key climate hazards include inland floods, coastal floods, wind gusts, heat waves, coastal erosion, inland erosion, landslides, droughts, fires, earthquakes, and tsunami. And as we speak, even today, we are experiencing some intense rainfalls and flooding in the country. And to give a context on the water, sanitation, and hygiene, on the right-hand side, you can visit the website. It's a WHO UNICEF Joint Monitoring Program on WASH. You can see that around 80% of the rural population has access to at least basic water, while in urban setting it reaches 96%. Basic water doesn't mean it's safely managed water. It only assures that water is available from an improved source with a maximum of 30 minutes for collection time. So we still do not have proper data on safely managed water, drinking water, sanitation as well. Only 52% of rural households have access to basic sanitation, compared to 72% in urban setting. 27% still practice open defecation. And also 22% of rural households appropriately use hand washing facilities. As you can see, there's a lot that needs to be done to improve the wash situation. So I'm just sharing an example of some of the photographs, how it impacts us. If there is an incidence of heavy rain or flooding, it not only in the agricultural areas, but across different cities, we experience floodings and landslides. So this is very common. Almost every year we experience this multiple times. So some of the challenges that we can face is, for example, groundwater pollution, saltwater intrusion, degraded water quality, loss of wetlands and water bodies, loss of vegetation, and also food insecurity, water insecurity, infrastructure damage. All of this ultimately contributes to waterborne diseases as well. And maybe some of you have already heard about some of the extreme weather events. In April 2021, cyclone Seroja caused widespread flooding and landslides, which displaced over 10,000 people and damaged critical infrastructure, including hospitals and laboratories in Timor-Leste. So one of the key questions that can be asked is, what are some of the key actions that can be taken despite lack of resilience and challenges at ground when such an extreme weather happens? So some of the immediate responses were there were obviously emergency health cluster coordination meetings, rapid health assessments, procurement and distribution of IPC materials, essential medicines and equipments, procurement of interagency health kits, diarrheal disease kits, medical camp kits, and also we have to ensure at the same time the primary healthcare integrated services are provided along with health promotion as well as continuous awareness. At the same time, we need to ensure that medical consultations were done in the evacuation centers and displaced communities, obviously, along with the Red Crescent as well. So there are multiple clusters that are formed for each areas, like, for example, even nutrition, GBV protection, vector control, and obviously wash and environment health as well. So when we talk about immediate response, some of the, we have to still focus on some of short-term, medium, as well as long-term actions that can be done so that to prevent future floodings. Some of the national level key actions, for example, that the government did was to establish public utility company called Timor-Leste. As you can see on the right-hand side, that there is a business plan, which you can refer later, to ensure that at least progress is made within next 5 years on the wash sector in the country. There are also certain decree laws that have been approved, like quality of control of water for human consumption, which is very much focusing on protecting human health from the adverse effects resulting from possible contamination. As well as there's a resolution on national policy for public water supply. And also just having policy at national level is not enough. There is a need for coordination. That's why there is an overall National Wash Forum or Coordination Committee, which involves all governments, ministries, institutions, partners, and stakeholders. There are also some key projects. Obviously, I'm not going to the government expenditures, but some of the current ongoing projects include a $30 million project of World Bank, water supply sanitation project, and also an ADB $127 million loan agreement. And also there are some other community projects such as PACRAS, Water Aid, UNICEF, UNDP, and other WASH partners implementing different municipalities and communities in the country. I just also wanted to briefly explain some of the activities WHO has also been doing to support MWORT. One of the key activities, climate and health vulnerability and adaptation assessments. WHO and MWORT undertook this assessment in collaboration with the James Cook University, the National University of Timor-Leste, and National Public Health Institute. So the main idea of this was to, at both national and subnational level, to observe and project climate change threats, understand the impacts of climate change on climate-sensitive diseases and health systems, as well as the adaptive capacity of health systems, to present some recommendations for a better adaptation to climate change. So it's a very comprehensive assessment, and we'll be publishing national level report and 14 municipal level reports, and also climate and health risk profiles. So which would give some kind of evidence to the situation of different climate-sensitive diseases, including diarrheal diseases in the country. So these are some of the photographs. I just wanted to highlight that how the field assessment took place, and it was quite intensive because it was done in each municipality, as well as there were interviews with key vulnerable groups and focus group discussions as well. So there are some of key political technical guidance documents have been developed. You can see on the right-hand side some of the documents that are in place that have already been endorsed. But one of the main document is the Health National Adaptation Plan, which has the goal to protect and promote health of Timorese people in a healthy Timor-Leste through sustainable and climate resilient programs. And one of the second component is on water, sanitation, and hygiene-related diseases. So it's very important that the HNF of a country also address these areas. And the other one is to strengthen national toxicology, water, food, and environmental analysis laboratory. Effort has been put into develop a national strategy for toxicology, water, and environmental analysis, to develop the national standards on water, sanitation, and hygiene and healthcare facilities. Also SOPs for national water quality and food safety. And also obviously multiple in-house trainings have been done along with our partners to strengthen and also provide recommendations to the government to improve and strengthen the laboratory services in the country. And also I just wanted to mention one of the installation of our water treatment systems, which we have done, which we received as a donation during the cyclone Hydrology. So as you can see, there are different versions of these systems, but the one which we have is quite mobile. It's a trader-based system which can do a fast-track filtration process and is able to provide safe water during emergency settings. And actually, it can be even provide water beyond emergency settings as well. So some of the key aspects is obviously, these are real photos from some of the water treatment systems we have established. So the water can be from different sources, but then it goes through this intensive filtration process. For example, there will be a sand filter which initially does the rapid filtration, which can kind of filter a lot of microbiological parameters, microbiological elements within the water. And there is the activated carbon filter, which usually helps to get rid of the toxic and organic pesticides and heavy metals and that component. And obviously, after that, we still need to chlorinate the water to get rid of any remaining eggs, helminths, or cysts that are remaining in the water. But so I'm just quickly explaining this layout, but if anyone of you is interested to know more details about this system, we would be more than happy to have a discussion and explain in detail how this system works. So in the photo, what we are seeing, the water is actually from agricultural waste of water, but then you can see the end result, how clear the water is after the filtration. So there are certain coagulants, flocculants that can be injected into the system.
Dr. Thimna, you have reached your time, to please complete it as in 1 minute or so. Oh, sorry.
Yes, thank you. So this is some examples of some water treatment systems that have been established. So in 3 municipalities is one, we have established the agricultural runoff water. In another place, we use spring water, which is pumped from a solar pump up to 200-meter elevation. And we use groundwater borehole. But as you can see from the diagrams, we just pump water into the machine, into tanks, and also to the storage units, and then supply to different places in the health facilities. And then obviously there is an initiation of early warning alert response system, which we have initiated for dengue, but there is a plan for diarrheal diseases and ARI as well. And also we have a unit GCO project that is currently ongoing, and a lot of people have been trained as well. So this is my last slide. So I just wanted to highlight the need for supervision and monitoring. We have actually pilot tested an online scorecard for climate resilient and environmentally sustainable healthcare facilities with the support from our regional office. So this is a self-assessment tool which the health facilities can use to monitor their crash level. And also, obviously, a lot of you would be aware of the JMP, and then we have just completed 2024-25 UN Water Global Analysis and Assessment of Sanitation and Drinking Water Survey, and the Timor-Leste survey will be published in few days. So that's all from my side, but thank you very much. I just wanted to mention that it's very important for us to take these key actions to make sure, when such a flood or anything happens, that we are able to adapt, we are able to respond, we are able to be better prepared to address, because our communities are quite vulnerable, and we want to protect the health of our people from climate change impact, especially among the small island developing countries, which are extremely vulnerable. Thank you very much.
Thank you, Thimna. So please stay with us. We will take the Q&A question at the end of this session. So our next presenter is Dr. Upasona Ghosh. Dr. Upasona Ghosh is an associate professor at the Indian Institute of Public Health, Bhubaneswar, with a PhD in social anthropology and an MPhil in women's studies. Her ethnographic research explores the link between the climate society and the health in the Sundarban, climate hotspot in India, focusing on systematic vulnerabilities and marginalization. With 14 years of experience in disaster-prone rural areas, she worked extensively in issues affecting women, children, and collaborates with government bodies and civil society organizations to strengthen grassroots climate resilience. She also teaches and mentors students in environmental and occupational health and sociology of health and well-being. Over to you, Dr. Ghosh, please. Thank you.
Thank you, Dr. Priya. Hello, everyone. My sincere apologies for not turning on the video. My connection is really bad. We are having a incessant rain here. So I will talk about a little bit of how the impact of extreme weather can go beyond the direct impact on health and the human well-being. And not only the flooding, we can see the flood as a manifestations of climate change, but in terms of climate change, sea level rise leading to flooding in the coastal portions of Southeast Asia region is it's a very prominent impact of climate change across the region. If we see the sea level rise in the Southeast Asia region, it is rising definitely, and it will continue to rise. So that means that the events of floodings, inundations, salinity ingredients will continue in coming years, even if we will be able to reduce the mean global temperature. So sea level rise, according to IPCC reports, is accelerating and will continue to rise up to 2100th century and beyond. Also, the extreme sea level rise events, which are prominent in particularly the small island countries and the coastal countries in South Asia, it will be there even if we reduce the carbon emissions significantly. So that is the projected model. Low-lying coastal areas of all latitudes will experience sea level rise by 2050. That means all these regions will have extreme flooding events as an extreme weather events till long time from now. So what can be the impact? Already the 12 million people in 23 cities of East Asia are at the severe risk of flooding. In Southeast Asian countries like Vietnam, Indonesia, Thailand, every year combined GDP is they are losing their GDP of 6.7 per year, 7% per year, and millions of people from the least developed countries and the small island countries like Bangladesh, India, Maldives, Sri Lanka are at high risk of losing their livelihood, like agriculture, fishing, and the drinking water supply. So, is the slide moving?
Yeah, it's your current slide is sea level is rising, this events and impact.
Okay, just a second.
Dr. Upasana, you want us to share the slide if you are facing some challenges?
No, just a minute. Yeah, is it visible now?
Yeah, but
Okay,
not
so if it is
slide.
visible in this, no, I think there is a problem in slideshow mode. So I think this is visible, right? So I can go with this.
But the words are too small. So if you don't mind, then like Daniele, can we do the slide share for Dr. Ghosh?
No, I don't have her presentation.
Yeah,
Yes.
I can. Yeah. It's okay. So you can stop sharing. We can share the slide for you.
Daniele, I'm sharing it right now.
No, I don't share. I don't have her presentation. She needs to present by her hand.
Okay, I think. Oh, yeah. Just a second. Yeah. We don't have. Yeah.
So can you please try to
Yes,
share
I'll share
again?
it.
Yeah.
I'm so sorry. I've sent it. Have you? Please check whether you have received.
You can try to share, Upasona. Because I don't have it here.
I have just sent it to you.
Yeah, try to continue and I will.
Yes, sure.
Yeah, thank you.
Fine. Thanks. Sorry for this disturbance. So we were talking about the flood-related impacts, sea level rise, and flood-related impacts in Southeast Asia. So this is the water-related disasters worldwide, which we have faced. But if you see, the most affected regions are definitely the Southeast Asia, part of North America, United States. But if you see this green, dark green patches in the global map, the impact is definitely very high. It's almost, the water-related disasters in number are 428 in this particular region. So now what is happening in course of this sea level rise and flooding? Let me present you the case of Bengal Delta. So Bengal Delta is a part of India and Bangladesh. This delta is called the Sundarbans Delta, which is a mangrove delta distributed between India and Bangladesh, and it's highly biodiverse, as well as very vulnerable to the climatic impacts. So due to the sea level rise and constant flooding, if you see the salinity immigrations in the entire region. So if you spot, you can spot the different dots which depict that, high saline, highly saline, moderate saline, and the decreasing water quality among these regions. Now, what is happening with this flooding, salinity, and its cascading impacts? So, firstly, the land and the agricultural land and the feed productions is getting worse and worse day by day due to this salinity immigration. So the people who are living there are majorly the agriculturists or the fisher folks, and they are losing their livelihood. So health impacts of salinity, we may be aware that there are a lot of complication related to the pregnancy, gestational hypertensions, normal hypertension during the normal course of life, cardiovascular diseases, diarrhea, abdominal pain, skin disease, other reproductive health issues. So there are a lot of health issues because of the high impacts of salinity, because people there have to stand, especially the women and men both, but women especially, they have to stand in this waist deep saline water for fishing, if you can see in this picture. Now, more longer term changes due to this flooding and sea level rise. So another major impact other than salinity is the land erosions. So sea level rise in Bengal Delta, though it is a very active delta, the erosions and accretion are the side of the 2 coins. But the rapid erosions in this entire region is making people losing their shelter, their livelihood, and as well as their lives also. So as a long-term impacts of this, land erosions are definitely losing the agricultural productivity, alterations in the food system, labor productivity, and migrations. So they are losing their assets also. There are very common social disruptions like displacements, school dropout for the children, and there are psychosocial care related challenges. So which has a long-term impact on the mental health of the people living in this region, like PTSD, anxiety, depressions, phobia, insecurity. And we sometimes noticed deliberate self-harm, domestic violence, and alcohol abuse. So more longer term impact, if we see in terms of this sea level rise, flooding, and salinity, land erosions, all these impacts combined, we can find that all these components which are related to climate change are having impacts on the social determinants of health in this particular region. So the first impact is definitely the water stress. So water salinity is increasing. As long as the water salinity is increasing, people are using more and more groundwater, and that is why there is a water stress, rampant everywhere. So mostly the women who are even more vulnerable, they have to cross waterlogged portions to access the potable water. You can see in these pictures, so only one hand pump for only working hand pump, which is still giving some sweet water. So using by so many people. So this water stress is creating havoc across this region. I already talked about the depleting agriculture, but the impact is very severe. If you can see these pictures, it has salinity in the ground, and most of the agricultural lands became barren, infertile, and highly saline, and the farmers are actually unable to grow. The region which was very sufficient in agricultural productions now totally became market dependent because their own productions is getting hampered to a large extent. Another major impact is drying of the sweetwater ponds and depleting the fish catch. So the region was have several sweetwater ponds, as well as they have sea fishing also. But all the sweetwater ponds either getting dried up or getting aligned, and for that small fish species are depleting, and there is a huge loss in fish catch. So as a coping mechanism, the people of this region are seasonally migrating, especially the male folk. They are migrating to the nearby cities for doing the manual laboring or any unskilled job, because their traditional livelihood was agriculture and fishing. So they don't have any other skill sets to go out and do some skilled job. So that's why they are mainly going out and joining in the marginal workforce. Women who are, due to patriarchal norm, unable to go out from the islands, so they are living there, and sorry, they still have to work whatever little resources they have within this region. So it's a kind of a triple burden of for the woman. They have to be the bread earners, they have to be the caregivers, and they also have to be the mother. So this triple burden of work making the woman, and there is an emergence of woman headed households which are more vulnerable and more stressed. So another examples of stress for the woman is, like, most of the women in this region are doing a crab catching as an alternative livelihood in the reserve forest area, which is a land for Royal Bengal tiger. So there is an increased human nature conflict, and many of the women who are taking this kind of strenuous and dangerous, risky livelihood, they are facing tiger attacks or crocodile attacks while going to the jungle. Another major impact is definitely the broken shelter. So people are losing their houses due to the land erosions, due to the floodings. So I mean, they are in a phobia that every morning they think that whether their home will be there or not. So many people I have interviewed, so they said that my cattle shed, suddenly in the night, middle of the night, my cattle shed just vanished into the water. So looking at these things, experiencing these uncertainties every day are making people very, very phobic. And there is a lot of cases of mental health, like post-traumatic stress disorders or anxiety. Another not very prominent but very implicit challenge is, I would say, that's called the climate bride. It's a very controversial term, but it is for the early and forced marriages of the young girls in this particular regions. So as soon as a flood is coming to these regions, and people losing their livelihood, they are to cope with that, they are getting their young daughters as young as 14, 15, they are getting married, those daughters. So it's for one less mouth to feed. It's marriages to the Middle East or the richer states within the country. Sometimes they are trafficked as being commercial sex workers. They have to take part forcefully in the touristic places within the islands. And so the pandemic situations making this scenario very worse. So it is a life cycle of it's a vicious cycle of the young girls and women. So they are facing this, early marriage, early pregnancy, and then again a low birth weight baby. It's a cycle. The life cycle is continues like that. Another impact is that the restricted health seeking behavior to the rural medical practitioners or the traditional healers, because due to the inaccessibility of the geographic inaccessibility, due to the less affordability, people are and the health systems reach also. So people are actually seeking health from the rural medical practitioners who are practicing allopathic medicines without any degree or any training. So this is a very harmful impact of the health-seeking behavior, somehow related to the climatic stresses and making the health situation worse. So there are also we found impacts of permanent migrations and displacements. Many people, so in the entire Bengal Delta region, a few of the islands have been vanished totally, and people have to replaced from there. People have to displaced from there to the another safer region. So this region, this permanent migration in Bengal Delta is never been a by choice, but it's a forced migration. So why this is happening? This sea level rise impacts are more or less invisible, and especially the related health issues is not at all a priority, because there is very limited knowledge about this sea level rise impact on floodings and in terms of salinity ingression. Sorry, my voice is very bad. Okay, so these are the there is a knowledge uncertainty. There is a science policy disconnect, because the policy is very much politically driven and not the evidence driven. And also there is an evidence uncertainty, because this kind of experiential data are not going into the policy making. So this due to this three uncertainty, the health issues related to sea level rise and flooding in this Bengal Delta region is not a priority of the policymakers. So I will stop here. Thank you so much. Happy to take any questions.
Thanks, Dr. Ghosh, for the wonderful presentation and the insight about the Sundarban area. Please be with us. We'll take the question answer at the end of the session. So our next speaker is Dr. Ahammadul Kabir. Dr. Kabir is a distinguished expert in climate change and health, water, and the environment, with over 2 decades of professional experience spanning government ministries, international organizations, NGOs, development partner, research institute. Academic, he has authored numerous articles, peer-reviewed journals, have contributed national and global knowledge platform. He holds a PhD in environmental chemistry and has built a career marked by deep interdisciplinary engagement across climate and health, public health, WASH, and environment. He is currently serving as a program officer for climate at WHO Bangladesh for past decades. So over to you, Dr. Kabir. Thank you. Dr. Kabir, you are muted, I think.
Can you see my screen?
Yeah, I can see the screen. Yeah.
Okay.
Please be a little louder. Yeah, thank you.
Okay. Welcome to the case study presentation on health impact of 2022 flood in Bangladesh. So Bangladesh is in Southeast Asia and is mainly an agricultural country. It enjoys a subtropical monsoon climate. Estimated population is 175 million. Three major transboundary river, Podda, Jamuna, Meghna, is flowing over the country. Administratively, country has 8 divisions. Each of the division consisted of several districts, and each of the district consisted of several sub-districts. So as the country enjoys a subtropical monsoon, it is prone to seasonal flooding. So objectives of this case study is to assess the health impact of Bangladesh flood 2022, review the emergency response and health service delivery, identify challenges and propose recommendation. Country had faced several historical floods. Those were very devastating, and the tendency of such floods has been increasing from past 3 decades. In monsoon, onrush of water from neighboring country through transboundary rivers, severe rainfall within the country that raises the water level in the main rivers and cause the flood. In 1998 and 2004, flood, more than 65% land of the country went underwater. People's miseries were reached to extreme in terms of shelter, food, and health. The flash flood 2022 in Bangladesh was devastating because of heavy rainfall in neighboring country and in country. Sunamganj and Sylhet districts were worst affected by the unprecedented scale and intensity. Sunamganj basically is a low-lying area. 75% land of Sunamganj and Sylhet districts were inundated for this flood. And the flood water, basically the water from the neighboring country comes through the Surma and Kushiara, two major rivers, which passes the Sunamganj and Sylhet district. The floods first wave started on May 10, 2022, and its second wave, which started around June 15 and lasted until August 2022. 22nd August of 2022. Here are some pictures of the flood events you can see. So the cause of the flood at Sunamganj devastating. Why it is so devastating? Because it combined. It is a combined impact of all factors. The natural factors were area is low-lying, heavy rainfall within a short span of time, water flow from neighboring country. The man-made factors were unplanned projects, inadequate and incomplete drainage and encroachment, siltation of rivers, and inadequate drainage. The incessant rainfall pattern in the area. Let us see the rainfall pattern according to Bangladesh Water Development Board. In May 15 and 20, a total of 2092 millimeter raining in the area. So upstream in Cherrapunji, India is 1,519 millimeter, and in Sylhet Sunamganj 573 millimeter. From June 15 to 17, a total of 3,232 millimeter of raining in the area. This is the highest 3-day precipitation in 122 years since the rainfall records began. The raining in Sylhet was much higher than the national average. On the right side figure, you can see the raining in Sylhet was much higher than the national average, whereas the raining in the drought-prone area is below the national average. Bangladesh, we are experiencing too much water during monsoon and too little water during the dry season in last several decades. The flood started in 2 districts in Sylhet division, and later it expanded to 22 districts of Sylhet and Mymensingh and Rangpur divisions. In the first wave, an estimated of 2.7 million people were affected, which increased to an estimated 7.2 million people in the second wave. The flood includes deaths, morbidity, property loss. The casualties, over 100 people died, hundreds and thousands of people are evacuated, rural roads, bridges, health infrastructure damaged, wash facilities damaged, loss of agricultural crops, water resource management infrastructure is also damaged. Here are some pictures. In the left side first picture, you can see the supply chain was disrupted. All the area are flooded. The health infrastructure is inundated with water. Then mental health of psychosocial health problems of the population, waterborne disease outbreak, acute watery diarrhea, acute respiratory infection, skin and eye infection. Drowning and snake bite are common, reproductive and sexual health problems and injury. Here are some statistics. You can see here. The damaged health facilities, actually, there are hospital clinics and community clinics. Some of them are fully damaged and some of them are partly damaged. Uh, Waterborne diseases are the major health outcomes because the flood water mixed fecal matters from latrine, household waste, agrochemical residue, municipal waste together and spread it all over the flooded area. In addition, altered precipitation patterns, increased temperature and humidity created condition conducive to pathogen growth, transmission, and persistence. The healthcare services was disrupted because the flood was inundated the healthcare facilities, health infrastructure were partially and fully damaged, supply chain disrupted, transport network destroyed, shortage of emergency medication, and the vulnerable populations were children under 5 and elderly, people with crawling illness, pregnant and lactating women with limited access to care, disabled persons with mobility and treatment barriers, peoples in low income. Response and recovery. For response and recovery, the country works in a collaborative manner. Government ministries and departments work as per the standing order on disaster, where the Ministry of Disaster and Relief played the lead role. The non-governmental organizations and UN departments work cluster-based approach. During the flood 2022, 2048 mobile medical teams work under Director General Health Services. Different organizations engaged in providing healthcare services like the district hospitals, medical college hospitals, Armed Forces Division, International Federation of Red Cross, Bangladesh Rescue Society, and philanthropic organization. They pre-positioned emergency drugs of medical buffer stock like antibiotic, IV saline, ORS, water purification tablet, and anti-snake venom, etc. The post-flood rehabilitation activities undertaken, the repairing of the damaged health infrastructure, vaccination and outbreak control programs were activated, provision of clean water and hygiene kits, mental health support for affected population, and also ensuring the access to essential drugs like water purification tablets, survival food kits, establishing mobile medical teams. So for these activities, Asian Development Bank, International Fund for Agricultural Development, JICA, Global Climate Fund came forward. Challenges were ensuring food, clean drinking water, and adequate sanitary facilities to lower the risk of waterborne illness. Cleaning and disinfecting the health facilities where flood-affected people had taken shelter. Keeping healthcare services running if the hospital is submerged and emergency drugs are inadequate. Managing ongoing and impeding communicable diseases outbreak with little drugs. Provision of recurrent fund for movement of mobile medical vaccination teams in different flooded area and availability of the health information like number of health facilities submerged, damaged, and equipments, etc. So role of the health professionals, they need to prepare themselves, need to prepare emergency response plans consisting of evacuation procedure, triage system, adequate supplies, medicines, equipments, resources, human and financial to ensure the continuity of the care during the flood. Response during a flood quickly assess the situation and tries patients based on the severity of their injuries and illness, provide health care, relocating patients while the hospital premises is inundated, managing resources including mental support. The post-flood recovery activities monitor the long-term needs of flood-affected people, rehabilitation of injured patients, play a key role for promoting the hand hygiene and other sanitation issues to protect waterborne disease. Coordination is also important. Need to work with different departments to monitor disease outbreaks and implement preventive measures by building awareness, risk, and safety measures among the community people. Some initiatives of the government for building climate resilience. When the regional cooperation on information exchange, early warning system, and public health communication harmonizes, then the risk of loss of lives and peoples and properties decreased from a disaster. In addition, capacitated professional and workers and the prerequisite for addressing a disaster. For building climate resilience on health systems, some notable activities were done by the Ministry of Health and Family Welfare are they have developed a health national adaptation plan, climate resilient workforce development. For climate resilient workforce development, they have included the climate and health issue in the MBBS curriculum, and also they have developed some training materials. The early warning system, climate informed disease surveillance early warning system developed and established. And also you see from the previous slide that the water supply and sanitation is the major problem for outbreak of waterborne disease during a disaster, a flood related disaster. So they have prepared a guidance on WASH-focused climate-resilient healthcare facility. So recommendations are improve health information systems for flood-prone zones, develop localized health emergency preparedness and response plans, train health workers for emergency deployment, construct retrofit climate-resilient water infrastructure in the healthcare facilities, increase investment in mobile and climate resilient health service during an extreme event, strengthen coordination and collaboration at national and subnational level, aware people about the disease outbreaks during and after the flood. So thank you very much.
Thanks, Dr. Kabir, for the wonderful presentation. So we'll now move into the Q&A session. Please request to all participants, please feel free to type your questions into the chat box. I will direct these questions to the speaker. So let's go to the Q&A session. So I will compile the questions. So we have received overwhelming questions from to the participants. So first questions are from Dr. Thimna. Dr. Thimna, the participants are requesting if possible, then if you can share any document related to LMS system, or is that the scoreboard is available online. So if these kind of any informations are available, please feel to share with the participants. And regarding the questions, the most of the participants sorry. So most of the participants are asking that either the Timor-Leste is facing any salinity. Start your video. Okay. Is facing any challenges regarding the flood, and which kind of flood that the region is facing. And I don't know why it is again. Okay. So which type of floods that the region is facing, and is there any HNAP in place in that region, and what about the action taken after these kind of disaster occur to secure the health of the population in that area, or what are their response plan? So can you please answer that question?
Thank you so much. So regarding the first questions about the scorecard, whether it's publicly available, no, not yet, because we have just pilot initiated it. But if any participant is willing to better understand the scorecard, we would be happy to have a separate session with them. But we do have all the templates that we can show how the scorecard has been developed and the type of checklist and questionnaires for what we call is a climate resilient, environmentally sustainable scorecard, which mainly uses the WHO checklist and guidance, but obviously we adapt it to the national context. Regarding the LMS, it's a very interesting system. So if I had more time, I would be more than happy to actually explain the engineering aspect as well. But yes, definitely, it's a very interesting system, especially in places where flooding happens, and then when we have the challenges of accessibility and availability of safe water, immediately the system kind of enables to do it in a very fast way. So definitely, there are some documents, we do have some SOPs in place, and we'll be more than happy to have a separate session and explain a bit more about how the LMS system works. As I mentioned, we already have 3 systems in place, and the 3 systems are quite different water sources. So we'll be happy to, you can reach to me at any time, and we can arrange the discussion. And regarding the flooding, yes, we experience inland flood as well as coastal flood, salt water intrusion. So I think we do have all type of flooding happening here in Timor. We have groundwater pollution, groundwater floods as well. But regarding the actions taken, I think I did highlight some of the actions that are done, but then there have been actions taken on coastal side from the government as well, and people have been relocated to different places as well. So there are some actions to make sure that it's more resilient as well. Due to limited time, I'm not able to explain in detail, but then if anybody wants to know more detail, I'll be happy to respond as well. And regarding the health HNAP, yes, we have a health national adaptation plan. I think I shared the screen online with the objective. So the HNAP is already published, it's publicly available, so anybody can access it, and we'll be happy to share the HNAP as well as other documents. I hope I covered all the questions. If not, please let me know, and then I'll be more than happy to respond.
Thank you. Thank you. So next questions are to Dr. Ghosh. Dr. Ghosh, you have overwhelming questions from the participants. But few of the questions are also related to Dr. Kabir. So, but I will ask, I will request Dr. Ghosh to answer, and Dr. Kabir, he can pitch in if he feel that you want to add a few things. So the questions are, first question are related to salinity and water-related disaster and diseases. So basically, it's they are asking that what is the relationship between water salinity and typhoid, and would you please share some water-related disaster source and salinity to Dr. Ghosh?
Sure. I think thank you for giving me so much things to answer. So see, when the water gets contaminated with salinity, so it has so many health impacts, whether directly with salinity or as a byproduct of salinity, there are a lot of impacts. Yeah, definitely, whether water is getting contaminated with saline water as well as with other contaminations due to the floodings, there are chances of typhoid. And there are a lot of literatures available. I would love to share all those with you. So yeah, those are a very established fact. But the major impact what salinity is posing to those area is increasing in the gestational hypertensions and preeclampsia. So those two are the most dangerous and very unnoticed impact of this salinity to the maternal and child health. So at the very beginning of this kind of impact of life, it's actually very hampering the fetus growth, and as well as later it's the impact in the newborn's life. So this is kind of a cycle, and then again the flooding continues, and that child would get exposed to contaminated water and other water related diseases like typhoid and cholera and many other things. So it's not a one-time incidence, but I would say the impact is kind of at different stages of life cycle. People are getting affected by all these flooding impacts.
Okay, thank you. The next question is also related to flood and the socio-economic disparities and government structure and climate change. Basically, they are asking that climate change interact to influence the frequency, impact, recovery of water-related disaster, which include your flood, drought, hurricanes at different regions of the world. What is the integrated strategies can be implemented to improve the resilience to most of the vulnerable communities?
Yeah. See, I mean, in most of the Southeast Asian countries, the disaster management system is quite strong, and it's really working well. I mean, and it's quite integrated also. But the problem is, the disaster risk reduction is only one part of climate resilience response. But the overall, I mean, increasing the overall resilience of climate change, it needs to go beyond disaster response, which needs mostly the very targeted plan and definitely the community participation. Like, let me give you an example. So I'm talking about the Bangladesh and India part of Sundarbans. So if you see the Indian part of Sundarbans, there is a general climate resilient plans, the climate action plan for climate change and human health, which is capturing the entire state of West Bengal, in which the Sundarbans is just a small part, not even a district. It's a small part, but that's a very generic plan, which is not, not able to mitigate the situations of the Sundarbans people are facing. So the region, vulnerable region like the Bengal Delta or the Sundarbans, or any kind of specific vulnerability, it is more targeted plan. So we cannot generalize, a generalized plan cannot solve this. We need to understand that these people have a special challenge, and we need to incorporate those things. And community participation is very important here, because community has their lived experiences. They can tell you that, what they are facing, because policy, I show it in my slide that, policymakers are sitting somewhere in Delhi or somewhere in Dhaka. They are not very they are not facing that problem day to day. So how they understand that what is happening actually at the ground level, very, very nuanced level, very localized impact. Climate change is giving us very localized impacts, which we cannot quantify to even within a large region. So that is a problem of policy making. But still, we have to, if we want to have a integrated plan, we have to listen to the community and incorporate the nuance, impacts and vulnerabilities to our integrated disaster management plan.
Yeah, so
thank
I
you,
would like to add on that
Yeah.
too.
Yeah, please go ahead.
The to talk about the water-related, floods-related impact, they impact differently to the lower-income people or vulnerable people than the high-income people. So one of the major issue is the displacement. The governments in these countries, developing or least developed countries, is struggling with the displacement because of the flooding. So one is that, and how we can what we are doing is, like, for example, in Nepal, we are working with non-government organizations and the local government. So planning and implementing the action plans to provide support, whether it's health or other supports, to reduce the damage of these extreme or water related disasters. So that is one thing that we are doing at the national level, but that is not sufficient. Displacement because of the water scarcity or because of the flood, relocation of them is the major issue, and we have to bring this issue regionally and develop some kind of strategy. Of course, in different communities, they might have different, and same strategy may not act, but for the displaced people, how we can work should be considered in regional dialogue.
Yeah, perfectly said. So we have similar question from Dr. Kabir related to flood. It's like it's also on flood. Basically, how the private healthcare system are helpful during flood, and is there any data available on non-communicable diseases and reproductive and sexual health related statistic regarding the flood? Dr. Kabir.
Yes, thank you very much. You can find the data from different sources like the government departments, health departments, and also there are some specialized NGOs who work on the health issue. They have this data. I think you can use the internet resources to get those data. Basically, I use in my presentation the data that I have received from the Ministry of Disaster and Relief, because the disaster department is the main department who played the lead role during any extreme event. So they can find data from there. And what is the second next other question?
Yeah, regarding the data and what is a private healthcare system,
Yes, private
helpful
healthcare
during the
system.
flood.
Yeah,
Yeah.
private healthcare systems are also helpful during the flood. But during the flood event, basically it is difficult, especially for this case in Sunamganj and Sylhet case, 2022 flood. It was very difficult to find a location where you can find a piece of, a non-flooded area where you can set the medical team can treat the patients. During these floods, people also take shelter in the flood centers. I mean, especially in the healthcare facilities, they also take shelter. So these are the challenges. The private healthcare facilities can also uh, provide their support during any uh, flood event in the country. But in that area, there were not that level of that number of healthcare facilities in that area. So the scope of providing service in that area is limited.
Okay, thank you.
Okay.
Dr. Kabir.
Yeah.
Coming to Dr. Archana. Dr. Archana, you have quite a few questions on GOLF, like glacial lake outburst flood. They want to know that any risk mapping of the region due to GLFO, and what is a return period of GLFO according to the data being provided here, and is there any preparedness modeling? So, Dr. Archana, so can you please?
Yeah, thank you for
Yeah.
the question. It is not mapped as a hazard zone, but the study has identified the number of glacial lakes that are highly potentially dangerous and dangerous lakes, and so it is identified via remote sensing, and for the potentially dangerous field work as well. For some of the potentially dangerous glacial lakes, what the studies have done is how if the glacial lake is burst, how it will be flow downward, and how it would impact. Only for a few glacial lakes has been done, but out of I think 5 or 6 glacial lakes in Nepal, we have reduced the level of the lake, so that has reduced the danger of danger of bursting. But the small lakes which has recently formed the dam has been bursting, and so that has creating cascading effect downstream. And so it has not been studied in systematic way, only case by case we have been studying.
Okay, thank you. We are now ending this session. So,
And regarding return
yeah,
period,
sure,
it doesn't
yeah.
have that kind of return period, but it highly depend on the temperature, the glacier melt, as well as if there is some kind of earthquake happens in
Yeah.
this region, then there is a potential of danger of bursting those lakes.
Yeah, glacier, its forecast is really challenging. Yeah. So we are now ending. Basically, just a second. Okay. Thank you for joining this session and staying engaged. So we just want to request that please don't forget to join the WhatsApp group for ongoing course update and the material. Please scan the QR code which is there on this slide. And we look forward to seeing you next week for the session 7. Thank you for being with us. Thank you.
Thank you so much. Thank you, everyone.
And highlighting the challenges about flood.